Today we are doing Botox for masseter relaxation. So a lot of times people clench in the middle of the night, or you can get headaches or have TMJ, and Botox is great to help relax these big muscles so that way maybe those symptoms get better, and we hope that they do. I have Masseter Botox and I absolutely love it because I grind through my night guards, and that's what I hear a lot of my patients say. So if they do say that, save your teeth, do your Botox. So I'm going to show you how easy a Botox masseter injection is, and I've already wiped my patient off, but we'll wipe her off one more time. Clench for me. Yeah, see, you can even see it unclench. You can even see her masseter pop out, clench, right there, relax. So that's exactly where we're going to inject, okay? You ready? And 1, 2, 3, hi, hi. So generally I like to always start with about 30 units, and sometimes people need more, but I've done up to 80 units per side before. And it can just help relax that muscle. It can help shape your face into triangulating your face. If you have a really square face because your masseters are sticking out, Masseter Botox can help triangulate it because it can help atrophy that muscle. And it doesn't affect your smile. It's not going to affect your chewing because you have 7 different muscles of mastication, so we don't worry about that at all. And she's not even bleeding. Was that pretty easy?
Oh yeah.
Yeah, perfect. Okay, good answer. All right, so we're going to go to the other side. And here we go. 1, 2, 3. Hi, hi. All right. And so this can take up to a whole month to kick in, but it can last you a year once you get to the right dose. Okay?
Mm-hmm.
Super simple, huh?
Mm-hmm.
Awesome. So I have my patients come back in about a month so I can make sure that their masseters are nice and relaxed. And if they need more at that point, then we do more. And if they don't, then voila. And we can, hopefully, it will last the entire year. The first time we do it, you know, while the first year, we're trying to figure out the right dose. So if this lasted her a whole year, she'd come back in a year, she would do that again. If it lasted her 6 months, she would do it in 6 months, and then we would know in 6 months, let's bump up the dose so that way it will last you the whole year. But you know what, we might as well roll into her typical Botox, which is up in her glabella and her forehead. So we're just gonna do that too because we're already drawn out. So relax your head back for me. And perfect. So I'm gonna start over your right eyebrow. 1, 2, 3, here we go. So this is the typical places people do cosmetic Botox for, but this can also help with headaches because sometimes people get headaches just from grimacing. And I like to do starting dose of 20 units up here in the middle and anywhere from as low as 14 units, but typically 20 units in the forehead. So we're gonna keep going because we did the Glabella now, or the 11, some people like to call it, right here. And now we're gonna do the forehead. So we're gonna start over the right eyebrow again. Here we go. And I don't know if even you know this, our cute little patient, but out of over 45,000 offices in the United States, we're in the top 1% with how much Botox and filler we do. So we do a lot of it. And it's really important to see somebody that does Botox a lot because you can have issues with it if your injector doesn't know what they're doing. So I'm going to come around the other side and we'll do the other half of your forehead because I wouldn't want just half your forehead to be perfect. This Botox typically, when we're doing it for aesthetic reasons, typically starts kicking in about 2 to 3 days. It can take up to 2 weeks, but it should last you 3 to 4 months. And then over time, sometimes people need more units as we age. Sometimes people need less because the muscles atrophy. So it really just depends on you and your muscles and how strong you are. But really side effects, she could get bruising, but she's not gonna because it looks great. And sometimes less than 1% of people can get a headache from Botox. I don't see that very often at all, but maybe because it's less than 1% of people. But usually there's no bad side effects. Botox will only radiate out a quarter. So if we treat up here, your right shoulder is not going to go numb. So people always get concerned about the possible side effects of it, but really the best side effect is really what you want, which is paralysis of the muscle. So, and then you just look prettier. they will also, Botox, people wonder when they should start Botox for cosmetic reasons. And I always say, look at your mom, look at your dad. If they have really deep lines here, start doing Botox earlier, because you probably learn the grimacing from them after watching them for many years. And we don't want you to get those lines really set in. So 3 or 4 months of Botox here will prevent you from furrowing, and then will be preventive from making any lines deeper. So you can say that Botox is preventative. We can also treat in the armpits for hyperhidrosis. You can do crow's feet for just wrinkles around the eyes. You can also treat this area here to help lift up the marionettes and kind of give you a little bit of a smile. So lots of places to do cosmetic Botox, lots of places to do medical dose Botox, but most importantly, do the Botox. So if you want to learn more about cosmetic Botox, medical Botox, you can find us online at RejuvenationMD.com.